Good afternoon. Today, I am here to discuss the challenges faced by COVID and the lack of affordable housing and wait lists that are currently in play. So I would like to say welcome to everybody who's joining the YEG housing webinar today. So first off, I would like to give Treaty 6 acknowledgement. I acknowledge Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux. I acknowledge that this territory is home to the Métis settlements and the Métis Nation of Alberta. So today I will be discussing the challenges faced during COVID-19 and the current affordable housing crisis. My name is Tree Stormhunter. I'm the Director of Programs with the Reaching Home and the Family Reunification Program. I'm also a full-time PhD student with the University of Manitoba in Natural Resources and Environmental Land Management. I focus specifically on the role of traditional ecological knowledge, the land use on ancestral territory, and better negotiations in regards to environmental land management. So today, though, I'm going to be focusing on COVID-19, what the current, the Reaching Home program and our current affordable housing crisis. So first off, the mission for Métis Capital Housing is to provide affordable and adequate and sustainable housing to low and moderate income Métis and Indigenous families within Alberta. So how do we achieve this mission? We work in cooperation with all levels of government and other agencies to ensure that housing we provide is affordable and sustainable. Métis housing consists of Métis Capital Housing Corporation, which was incorporated in 2007, and the Métis Urban Housing Corporation, which was incorporated in 1982, and we are owned by the Métis Nation of Alberta. So let's look at why the Reaching Home program. You will see the first cited source is from 2001, and what they recognized back then was at a national level, it was estimated that Indigenous people are about 10 times as likely to experience homelessness when compared with non-Indigenous populations, 2001. Now we're looking at 20 years later, and currently the Homeless Hub reports that urban Indigenous people experience homelessness at a disproportionate rate and make up a significant percentage of people experiencing homelessness in cities. So it usually shows Indigenous homelessness in major urban cities ranges from 12 to 50% of the total homeless population. And then in the back is a picture of a Red Deer homeless camp in 2020. So what are the structural factors that lead to this significant number of Indigenous homelessness? So structural factors can include transitions from reserves and settlements to urban living. It includes racism, landlord discrimination, low levels of education, and unemployment. So specifically, structural factors that contribute specifically to Indigenous people's homelessness is again cited discrimination and racism. There's also involvement in the criminal justice system. There's also child welfare system that also play a role in escalating the risk. Now, if we want to work with our Indigenous population, there's some best practices for homelessness. So the first thing is to have good partnerships and relationships with other Indigenous organizations. It's good to have Indigenous governance and coordination, so our people leading the pathway for our people. It's good to have adequate and equitable funding. A lot of times funding comes in short-term amounts and there's no permanent type of funding that's available. So often grants and initiatives, programs that are started due to lack of funding, they have to end abruptly, which again leaves us repeating that same cycle. We should have Indigenous staff. We should be promoting cultural reconnection. So a lot of times when people leave their communities and come to urban centers, we need to be connecting them with appropriate cultural supports. Also, we need to have ongoing research and evaluation. So are we doing what we say we're going to do? And there needs to be a sense of cultural safety. So I like to think that when like-minded people live within a community and together, that they can become a community and take care of one another. Now, why is Indigenous homelessness so high? So we look at that intergenerational trauma. So we know that it can be traced back to historical trauma. We look at oppression, racism, discrimination, and many of the personal issues, including family dysfunction, substance use, addictions, health issues, community violence faced by Indigenous people, act as contributors to homelessness and are directly linked to various types of historical trauma. So again, what happens is we have family violence, we have child welfare, we're the 60s scoop. We look a lot across Canada, Indigenous children are significantly higher represented in care. We look at mental health issues from the historical trauma. We look at substance abuse, self-medicating. With the residential schools and 60 scoops, a lot of times individuals or Indigenous people grow up without a sense of belonging. So they join gangs. They end up going to prison. They come out of prison. They have these systemic marks on them. So homelessness then is an issue. And then, of course, health. So when looking at a survey completed by Stats Canada, Indigenous participants more often reported that COVID-19 had a strong or a moderate impact on their ability to meet financial obligations or essential needs more than non-Indigenous participants. The other thing that it really showed was COVID-19 really shines a light on hidden homelessness, which involves people couch surfing or finding shelter outside of emergency housing. So if you look at the chart, and we look at the Indigenous participants versus the non-Indigenous participants, we see that the orange is significantly higher for experienced job loss, reduction in work among participants employed before COVID-19. And also that with the blue reporting a strong or moderate impact of COVID-19 and ability to meet financial obligations. So if you look at these two charts, we can see that COVID-19 has really exacerbated the socioeconomic inequalities and the oppression that Indigenous people already face in our systems. So let's look a little bit more into hidden homelessness. So hidden homelessness the population falls under the category of provisionally accommodated. So the definition refers specifically to people who live temporarily with others, but without the guarantee of continued residency or immediate prospects for accessing permanent housing. So frequently identified as couch surfing, everybody's heard of that term, couch surfing. It's a term used to describe people who are staying with relatives, friends, neighbors, or strangers due to a lack of options. Usually couch surfers don't pay rent. It's theoretically an unsustainable living arrangement, and they can't afford their own permanent housing. So hidden homelessness is hidden because these individuals do not access homeless supports and services, even though they are improperly or inadequately housed. So as a result, they don't show up in statistics. And so they fall through the cracks. So approximately, I would say up to 60% of the RHP applicants fall into this category. So what are some other challenges that are faced by Indigenous communities? Let's see if I can move that one there. All right, so additional challenges for rural Indigenous communities during a pandemic. So one of the things is healthcare access. So what is the challenge? You look at the lack of information in Indigenous languages. You look at underfunded healthcare centers. You look at the availability of PPE and COVID-19 tests. So an example of this is Métis villages in northern Saskatchewan without financial support, supply chains, or pandemic due to unclear jurisdiction between federal and provincial health systems. What are preventative measures? So what is the challenge? Isolation difficulties due to poor housing, overcrowding, lack of hygiene, clean water for effective hygiene, and significant poverty and food insecurity. I've worked in many northern communities where they rely on the winter roads in order to receive their supplies. The winter roads that were normally open for up to maybe 6 to 8 weeks due to global warming are now only open for 3 to 4 weeks. And so they're unable to have supplies go up there. There's a First Nation community, Abamatung, in Northern Ontario, identified overcrowding as one of the major issues for their pandemic response. The average number of people in a household is between 6 and 18. So it's very essential that we don't bring COVID-19 into those smaller communities because it really impacts their ability to effectively manage the pandemic due to housing and lack of housing or poor housing. And we look at other risks for community. You know, the challenges are isolation means that families and communities cannot work together for childcare or teaching cultural practices and knowledge. We look at in a lot of the rural communities, the Aboriginal Head Start programs have closed down. We look at elders and knowledge keepers cannot visit families in their homes because there was that one bubble room isolation, which plays a significant impact for Indigenous people who are a very collective society. Gatherings, wakes during times of grief, ceremony, all of these important culture and traditional ways that we connect with one another have ceased during the pandemic. So family and caregiver burden, you know, we look at challenges of a loss of income, difficult access to childcare, caregivers' illness leading to child displacement and lack of internet access. Many rural and northern communities, such as Nunavut, have minimal access to high bandwidth, posing challenges to online learning platforms. I'm going to do another example here of the county of Lac-La-Biche in northeastern Alberta partnered with the Métis Nation on a temporary camp for the homeless people in July. So this is just a picture of the camp that was created as a temporary shelter for people during the summer. So we look at the federal government and the Reaching Home program. So specifically Indigenous people refers to First Nations, Métis, and Inuit status and non-status. So again, Indigenous homelessness are people who are in a state of having no home due to colonization, trauma, or whose social, cultural, economic, and political conditions place them in poverty. So again, this refers to the couch surfing, living with family, living in inadequate, substandard, unsafe accommodations, living out without any sustainability or security. You know, and that's one of our basic needs as a human. Food, clothing, and shelter. And you aren't able to focus on anything else, any of your traumas, if you're trying to secure food, clothing, and shelter. So the federal government wanted us to have a coordinated access. So like there's one access point where we do an assessment, we do a prioritization of the families in need, and then we do a coordinated access into the intervention, and then we do data collection and management, and then matching and referral services. I provided the website on the slide before, so you're more than welcome to go and look at that and read up on the program initiative. So in order for RHP applicant requirements for funding, you need to complete a signed or original application. You have to be a Métis Nation of Alberta citizen. You have to have 2 pieces of identification, the most recent notice of assessment from the previous year, and a 90-day bank statement. And we use this for affordability and permanency housing because that's the goal of the Reaching Home program. So RHP has 2 pathways. So the first pathway is you must be a member, again, of the Métis Nation of Alberta. Pathway number 1 is for singles and families. And pathway number 2 is for youth in care or youth transitioning out of care. Again, Métis youth. So what does the Reaching Home program assist with? Well, we do assistance to help avert eviction. We do assistance with utility arrears, rental arrears, moving, potentially storage if required. We'll do budgeting workshops, credit counseling, look at shared housing, and the most important is prevention. So sustainability and prevention, so you don't end up in the same circumstance in the future. Again, applicant support services available. We do life skills development, cultural support for citizens, referring them, connecting back to their Métis culture, financial support. We do startup groceries. We have a home setup of basic furniture. If you've been living on the street or living homeless or couch serving, technically you probably don't have any furnishings for your house, so we will provide the basic furniture. We provide access to technology and public transit tickets to get you to those important appointments and stuff that you need to get to. So, economic integration. We assist with accessing income benefits and advocating for AISH if you've put in an application and if you're unable to connect with those services, we'll provide support with that. We'll assist with job search, resume writing, interview process, and also with education and training assistance. For example, Trade Winds to Success. If you're interested in the trades, this is an excellent program that usually leads to secure employment. So at this point, I will just go through the Reaching Home for the Métis youth. So it's a partnership with CFS, and it's youth in care, youth leaving care, and we'll continue on to provide that mental health, addiction, and cultural support. So what does that look like? There's a CFS referral. We complete a contract with the CFS region. We need to have a committed youth. We look at a path of sobriety, and we provide a number of workshops, tools for success, workshop and counseling. We do a harm reduction, trauma-informed approach with our youth, and the program length for our youth to stay is 12 to 18 months. We have administration, so there's myself, the director of programs. We have 2 outreach workers and 1 program assistant. We divide Region 4 north of the Saskatchewan River. So 1 outreach worker will cover North Region and Edmonton, and then Region 6, 5, and 1. And the second outreach worker will cover south of the Saskatchewan River, North Saskatchewan, and cover Region 2 and 3. So I'm just going to have a quick look to see if there is any questions so far that anybody has at this time. And if there's not, I will continue on with the presentation and we can have questions at the end. I can share these slides after the presentation. I will send them, I will make them available. So this is one of the questions that I have. I can share the slides. I just want to finish uploading, just ensuring that every single reference is on the slides before I share them. So if there's nothing at this time, I'm going to move into our Reaching Home program framework that we work from. So this is a framework that I developed through the Giving Tree with the 12 Métis values, and from Dr. Martin Brokenleg, Reclaiming Youth Network, and the Circle of Courage philosophy. So we start with the Métis infinity symbol, and we look at the 4 quadrants or the 4 areas of generosity, belonging, mastery, and independence. And in the center is the heart of our Métis nation. And so the values, Métis values under each section of Dr. Martin Brokenleg's Circle of Courage. Under generosity, we have caring, sharing, and kindness. Under belonging, we have honesty, love, and respect. Under independence, we have courage, strength, and tolerance. And then under mastery, we have patience, balance, and Mother Earth. Now, what do these look like when they're placed into action? First and foremost, under belonging, we look at parents were taught to serve as role models for honest behavior. Other people's boundaries and possessions were always respected. We look at love, developing unconditional love for yourself, your family, your community, your nation, and all of creation was important to the Métis. We look, respect was integrated into all areas of life. Respect for the Creator, Mother Earth, the living world, and oneself. So what would those workshops look like? So first and foremost, we know self-worth and self-esteem is huge for Indigenous people. A lot of times they've grown up in broken homes or through multiple placements in child welfare. So we want to work on that core spirit and provide them with a sense of belonging. We look at personal boundaries. Under love, we look at colonization and attachment issues. We look at the family tree, self-love, and confidence boosting workshops. Under respect, we look at what is respect and what does that look like for you. We look at personal development, forgiveness, and letting go. We need to let go of the past before we can move on in the future in a healthy way. Under mastery, again, we have patience, balance, and Mother Earth. So we need to learn to look, listen, and learn. It was a very highly valued skill. When you look at balance, worldview is the great law. Living the balance mentally, spiritually, physically, emotionally was stressed. Great levels of reverence for Mother Earth and respect were practiced by the Métis. So we need to be honoring the land and all the gifts that she provided. So when we look at workshops, we look at under patience, we look at communication and ethics workshop. We look at grief and loss. A lot of times, why do we keep going back and repeating those same patterns? Because we have compounded grief and we haven't let go of a lot of those experiences that either us personally or our ancestors went through. We look at balance, so addictions. Why am I self-medicating? How can I live a clean and healthy life and make good choices for myself, my children, my great-grandchildren, and so on? We look at relationships, unhealthy and healthy. Finally, Mother Earth, we look at ceremony. What are you interested in ceremony? What would you like to connect with? Medicine picking, giving tree workshops, reading the story. I know for me growing up, our elders would always tell stories. And if there was 10 of us listening to a story, each one of us listening would take something different from that story. And it's what we need to learn at that particular moment of time. So storytelling is very huge for our Indigenous and Métis families. Finally, we look at independence. And we look at the courage, strength, and tolerance. So we need to take risks for the betterment. We need to be able to stand up for injustices. So that's giving our people voice about what happens to them. And instead of talking directly to them, we make a plan with them. We look at strength, so healthy competition and hard work. So having tasks and goals and challenges that can be met. And we think about COVID-19 and the pandemic, there's many challenges that we're facing. And what kind of supports are we providing for our Métis people so they can get through this hard time? Strength and resilience are key in this day and age. And then we look at tolerance. So how do we debate and discuss matters with others in a good way? A lot of times for where I come from, we had our clan system. And so different clans had different roles in mediation and negotiation. So what are those kinds of workshops that would fall under each of these categories or under each of these values? We would look at personal goals and action under courage. What's your next step? Is it schools, trades, employment? Where do you see yourself in the future? How do you fit into this world? We look at for strength, workplace culture, human rights, employee rights. We can even look at UNDRIP, Indigenous rights. What does that look like and how does that relate to me navigating on Mother Earth? We look at tolerance, so conflict resolution, lateral violence, again, being able to negotiate and discuss things in a healthy and positive way. Finally, we have our generosity with our caring, sharing, and kindness. So caring for yourself and others was expected, and caring for those who couldn't look after themselves. Sharing your gifts, with others. Children were taught to give from the heart. And again, kindness, all acts of kindness were acknowledged. Sometimes I see us forgetting to acknowledge these acts nowadays and only acknowledging things in people when they're doing something wrong or something that you don't like. We're so critical or quick to criticize rather than looking for that light and providing hope and inspiration and motivating our people to move forward. So what does caring is self-reflection, doing a vision board, civic engagement, helping others out. You always feel great when you do that. Looking at sharing gratitude and appreciation, being grateful for the life given and the opportunities that you have to move forward, even despite being in a pandemic. And again, positive self-talk workshops, kindness and compassion workshops. So these are some of the ones that we have created so far, and we're looking forward to receiving feedback and creating more workshops that would fulfill or that would fit under the Métis values, and again, embrace the circle of courage. So here's a quick success story. So this was an elderly gentleman who was living in a car in his friend's backyard. He was served with 30 days notice as the place he was living in was sold. So excuse me, you'll see a picture of the two cats. So he was living in an elderly gentleman's backyard. The cats were living in an old garage with no windows. So they were in the dark about 16 hours out of the day. And this individual would go and open up the door and spend time with his cats. So we were able to go down and sit with him, figure out what he needs. He was really motivated to get his own place. So after he secured his residence and his finances, everything's stable, he wanted to send us pictures and thank the Reaching Home program for not leaving him in a car in somebody's backyard. And so he was real grateful for the support services, and he is a successfully closed file now. So I'm right kind of on time, and I wanted to have a little bit of a question period. If there's any questions that need to be asked. Is CFS the only agency able to complete a referral for the youth program? So because our contract is with CFS for Métis youth that are transitioning out of care, you would, and yes, they would, because there is a fee for service amount that is attached to that. And so CFS has to be willing to enter into the contract with the Reaching Home. For the initial services for Reaching Home, we provide that under the Reaching Home contract, but for the ongoing outreach up to 12 to 18 months, there would be. Could I please have the slideshow sent to my email? Well, you can see that I will provide my email at the very end after this. It's tree.stormhunter, TREA.stormhunter, just like it sounds, STORMHUNTER at métishousing.ca. So I will provide that on the screen, and please send me an email. I would be more than happy to share my PowerPoint slideshow with everybody that wants. So is there any more questions that we have? We've got about 2 minutes, so if you can type fast, fire them off, and I'll answer them as best as I can. I think maybe just once again, we can go back if you want to make a referral. Let's go, my great slide here. Right back here to this slide. If you have any questions, there it is, our applicant requirements. So you'll see the email below is reachingHome@métishousing.ca. You can download the application off of our website at www.métishousing.ca. I believe you go into housing programs, you'll see Reaching Home. You can go there, download the application. If you are a CFS worker, or if you are working, for example, at the Youth Emergencies Shelter and know of a Métis youth that could be transitioning out of care and benefit from our services, please contact their CFS worker and introduce them to our program. We love to get out there and help our people not just survive, but to be able to thrive like all other human beings in Canada. When given equal opportunity, our people are very successful. So I just want to say Chimigwech, thank you for taking the time to participate in the webinar today. Oh, where are you from? So sorry, I didn't even do that beginning. So my name is Tree Storm Hunter. My family comes from Bay Mills Indian community in Michigan. So I am Anishinaabe and my mother is Ukrainian and Irish. So I make bannock pierogies, really good. Most people refer to us as Native American, but I prefer to refer to myself as Anishinaabe. Can you please go back to the slide with the link? So right here, the Reaching Home at métishousing.ca is the link. And you can find that on our website at métishousing.ca. How long does it take for through the program? So sometimes it depends on the finances and the situation of the person. Some RHP applicants have completed their applications, submitted all of their documents. We've completed the outreach. We did the verification of all the documents and we've closed their file. They've been in and out and found a place in 2 weeks. Others are a little bit more challenging and it's taken up to a month. But the most important thing is to submit all of the supporting documentation with your application because we cannot proceed any further without that. So it's very important. So these 5 items that you see on the screen before you must be submitted. So I think that is my time for now. Again, I'm open to any questions that you have. You can also reach me at the Reaching Home or my personal email, and I will be sharing those slides out. If you would like a copy, send me an email. And thank you very much for participating today, and you have a good day. And I got to figure out how to get out of here. Miigwech.